I'm the one that discovered Sovereign, looking online for programs. We are in Arizona, and we knew that there weren't a variety of programs, and different professionals had not expressed confidence in the residential treatment programs, which we felt our son needed. So I started doing midnight internet searches, looking for adolescent mental health programs, and came across Sovereign, saw the site, was impressed by it, left a message, and someone called me right away and was impressed and shared it with Stan.
I think overall the family unit was beginning to break down because of the pressures that we learned over time that Garret was beginning to feel or think that were being put upon him, not only by the school he was attending or by his friends, but even by us as a family, which of course led to suicidal thoughts, self-injurious behavior, different things according to that, and we just said we can't do anything more for him. We need help. And
yes, we needed more help than he was presently receiving. He was seeing a psychologist for therapy, he was seeing a psychiatrist for medication, and we knew that we needed something substantially more. He seemed to be going downhill. I mean, we knew that we had to watch him 24 hours a day. We had to lock up anything sharp or medications, and we were fearful. We needed somebody to help us turn that around.
The family unit was beginning to break down. Everything became an argument, everything became a struggle. It just really, lack of a better way to describe it, it wasn't fun anymore being a family. It became more of a job, and that's just not the way we want or we think our family is meant to function. I mean, not that you can have fun every day, but there's got to be a sharing of love, unconditional, and that was just falling apart, and that just led us to a crisis. One of them was that it had a program for adolescents, where when we looked around in the Arizona area, those that we thought might be suitable didn't have that. Garret would be with a different group of boys, some older, some that were using drugs and alcohol, and we thought a separation that that could deal with his mental health without conflict of the drug abuse and the alcohol abuse was best suited for him. And there were some other concerns that Joyce had that she'll express.
Well, in looking at some of the programs in Arizona, and even touring them, facilities that unlike Sovereign didn't allow any outings. So basically they were confined behind a fence, and to me that was more of a punishment. And we asked the question like, oh no, we don't do outings. There's also concern that, as Stanley had said, that combining populations. So when you're combining mental health with children that are dealing with substance abuse, it's like apples and oranges. I mean, they're okay. We both wind up having that mental health, or that piece that led them, one to injure themselves, another to abuse some substance. But there was also that piece that many of the students that were, or the residents that were there for substance abuse, were also there under court order, and we were we're talking about a whole other population then in terms of delinquency, and we felt that our son being just 13, being very small for his age, that and having gone through so much bullying over the years at school, that we were throwing him into the lion's den.
I think we both came away with the feeling and knowing that we did the right thing. By coming here, the initial meeting with everybody, again, just leaving, we know that he was in good hands. The best hands that we could have chosen for him at the time, because it's not an easy decision at all.
One, when we didn't count out the staff versus the children, but it did seem like there was a high ratio of staff, very high staff to adolescents and patients. And no matter what their position was, everybody knew your child. It's like, oh, you're the parents of Garret. Oh yeah, Garret's a funny guy, or oh yeah, Garret did this. And we were impressed that even though they were not their clinician or belonged to their house, everybody knows everybody, all the way up to the director. Dr. Lee, the first time when we came for a family weekend, and we went in for a meet and greet. I believe we both thought it was just a meet and greet. Hi, how are you? I'm the doctor, but for her to be right on and with Garret, and just that 4 weeks she knew him, and for someone that high up the scale in a facility, that was impressive. Even today.
And earlier that day, Dr. Mattis had mentioned about Dr. Lee saying that, yes, we understand your concern that she's very hard to get a hold of sometimes because she does have a practice, but she's always here, and she knows all of your children. And as listeners were saying, okay, right, yeah, she can, all 60 people, I'm sure she knows. And after meeting her, I believe her. She did.
Yeah.
Oh, yeah.
And she, in terms of even being able to spot things with Garret right away or calling him on something, and she already knew the affect, the tone. Yeah, so you knew that she knew.
The feedback that we've gotten from Garret, he's thought that they've helped. He's believed that they've helped. We can see that they've helped. That's the best way for me to say it.
Yeah, I believe each week, I think it was 1 week it was a little rocky, and that's just because of the issues that were being brought up, but I wasn't as confident going into it how a family therapy session would work by phone. I have a hard enough time having a conference call, but then you're having a therapy session and the awkwardness of, okay, you have a therapist and you have your child and there's two of us and you're not all in the same room, so then you're all trying to, okay, who's going to talk? Usually if you're in person, you can see the anticipation, somebody leaning forward or their mouth is about to open, but it worked smoothly and they were very productive. Everyone was very productive. And the therapist was able to communicate to us. We might be able to kind of read through the phone when our son was starting to get anxious and upset, and she would tell us, okay, he's feeling anxious, and we're going to stop for a minute, and we could hear her doing relaxation techniques. I think it works. You can do family therapy from afar.
I learned that I still have a lot to learn. And that's the most important thing. And I think that, Garret immensely. It's not all Garret.
I agree that it's, we all need to make changes. There are things, in terms of how we just work as parents. It might have worked for one child, but it's not working. It didn't work. It wasn't working for the other child, and that something came up this morning in the group, and one of the parents likened the process with our children is that to what's the dog Cesar Millan, the dog whisperer, and then that it's not he approaches a case and says I'm not really training the dog, I'm training the owner, and really that's a good part of it. We had 2 books that were suggested by the therapist. We've read them both, and there were aha moments for us, and things are highlighted and saying how we fed into it, thinking we were doing the right thing, but it really wasn't productive for our son and his with his mental issues at the time, the anxiety and depression.
I think the test of time will answer that, but we are extremely optimistic that it is going to work. Our older son, who wasn't able to come this weekend, he is also optimistic. He's looking forward to his little brother coming home, and he's going to work with it too. So just being optimistic, and we've been given a lot of tools to work with. So.
Yeah, and we know there are going to be hiccups and some steps taken back just as part of coming home and getting used to each other. We're on the road to a better family unit and going back to the way it was years ago. I'm more relaxed. One, knowing, I guess, what the triggers are for our son, knowing a little bit more how to handle them and how to handle myself, things that I can change.
And I think for me, and we talked about it, or we joked about it, how much the psychology has changed since we grew up. And I joked with somebody the other day, I said I may have gotten an A in psychology 101 and 201. I said, but I'd fail them today because it's just a complete opposite. And I think that's been an immense help for me. That's been an eye-opener for me. Again, opening that I still have new things to learn, and I know I have the ability to learn. So it's only going to help us.
Yeah, and you going through the one book that you suggested that we read it, and it talked about, it would give different cases of behavior, and it would talk about the traditional view, which of course is what not necessarily raised with, but we both studied, both having taken psychology and the typical parenting books. We were always say, oh, that was us in the traditional, and then it showed the new view of what works, and specific to children that have anxiety, depression, attachment. I mean, that was a surprise to us to even think that our son could possibly have attachment difficulties because he was adopted at 2 weeks old. To us, we think attachment problems. You adopted a child that was in the foster care system in neglect, or you adopted a child in Russia that had no stimulation prior to that, and realizing that there are attachment issues even from an infant, and having that transition period, and that he might not have realized what it was. We didn't realize it, but there is something in his head about it.
His ability to smile again.
The way he walks. He's walking prouder. He's standing up. He's sitting up. Yeah, the tone of his voice, his affect, he just sees overall. And we're not over the hump. we just had a therapy session, and when things, things came up that had to do with like maybe the schedule of school, you could see, okay, a little bit's coming back, and so we know already that, okay, these are triggers. We know we gotta stop, we gotta let them know it's not time for this yet. Let's take one day at a time. But he's like a lighter person.
Me being a fan of the art of communication, I think if communication breaks down, everything breaks down. The group at Sovereign, from whatever area to whatever area, have never lost the ability to communicate. They're always quick to call you if there's a good news or if there's a story about a concern. But it's been fabulous. Just very plain and simple. I think they're all exceptional. They all had their times, but I don't think one overshined the other. I can't give one any more credit. I think as a whole, you function beautifully,
Yes.
and that's again for me. That's the best way to describe it for me.
And we have 3 packets. We took an extra one to bring home, leave with one with the doctor, keep another one, and to say, this is the place to go.
Don't be afraid to make the hard decision if it means, bringing your son or daughter to a place like Sovereign or to any place. You have to be willing to make that hard decision and to be willing to say that you don't have all the answers. There are people that know more and that can work better with your son or daughter, and even with yourself.
Yeah, and that we needed, that we have things to learn,